September 28th, 2021 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Colby.
Here.
Mrs. Vaporio.
Here.
Ms. Hasman.
Here.
Mr. Hebert.
Here.
Ms. Lamar is excused. Mr. Lee.
Here.
Mr. Marionetti. Here. Chairwoman Taylor.
Here.
And Mr. Udelson.
Here.
Is there anyone signed up for public forum?
There is not.
Is there anyone present who is not signed up, who would like to address the committee at this time? Seeing none. The next item on the agenda is the approval of minutes. You have the August 24th, 2021 meeting minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk.
Referral 21-0328, authorized funding for a position at the Cornell Cooperative Extension of Monroe County to expand the existing Cornell Cooperative Extension nutrition program and strengthen Cornell Cooperative Extension public health outreach.
Move it, Madam Chair.
Second.
Moved by legislator Hebert, seconded by legislator DeFloria. Is there any discussion? Legislator Udelson?
Thank you very much, Madam Chair. Through you, I just wanted to note that county already provides significant funds to Cornell, great agency. Referral states that this will fund the physical position, and I just had a question for either the makers of the motion or the original sponsors, anyone who's available or willing to answer. Is it contemplated that the county would fund this position going forward, or is this just for this program?
Legislator Brewer?
Yeah, as one of the makers of the motion, the Cornell Cooperative Extension is aware that this funding is just funding for this year. They hope to be able to get this additional individual up and running and providing those benefits of the additional nutrition outreach, and hope to secure permanent fundings from this point forward. They fully realize that may not be possible, but they certainly realize that the 65,000, I think it's 65,000 being provided under this referral would provide them with a good start and a good foundation to secure those additional funds in the future.
Thank you, and also through the chair, where will this funding come from? Like this, you're the majority leader.
Yeah, I can also reply to that. I believe the referral identifies the source of the funds from the Community Contingency Fund.
Thank you. And last question for me, through the chair. Have you had any conversations with the administration about this issue and possible ways other than the contingency fund to fund it?
Through you, Madam Chair, no, I have not.
Thank you.
Is there any? Yes.
Madam Chair, through you to the maker of the motion, can you just provide a little more detail what this position, what their job duties are, will be?
Yes, Madam Chair, I think I may be able to provide some feedback on that. If I may, I do have some prepared remarks, and why don't I just go through those now, and that may answer a number of questions, not only your questions, but any future questions that may be asked during the committee meeting here. Okay. Cornell Cooperative Extension provides a myriad of services to our community, ranging from higher education services to helping families and those in need with a multitude of human services programs. Andrea Lista, who is the executive director, has been a leader in our region while at Cornell Cooperative Extension for nutrition education and food access for those who are in need of it. This referral is intended to be a catalyst to jumpstart an expansion of the current nutrition education and food access programs with the intention of the county budgeting for the additional positions in the annual Monroe County budget. Currently, the 4-member team working has a limited scope in the City of Rochester, East Arundecoit, and Gates Chili. With the addition of the 5th full-time nutrition educator, this program will be able to expand its reach into our more rural areas where there is still a significant amount of poverty in our region. This funding will cover the salary of one full-time general nutrition educator and the cost of their supplies and mileage. Cornell University provides the bulk of all Cornell Cooperative's extension benefits. In other words, the Cornell University does provide the fringe portion of the workers' total compensation. Supporting, and the one final bullet here, supporting the establishment of this position is supporting increasing vital health and nutrition education resources throughout Monroe County, and I hope for unanimous bilateral support for this legislation.
Thank you. I have one more question. I apologize for my ignorance on this. You're going to share to the neighbor the motion. Can you tell me about a nutrition educator? Is that someone who's a registered dietitian, or how that, or you don't know off the top of your head, that's fine.
Through you, Madam Chair, I do not know the professional qualifications.
Any other discussion? Legislator Dvorak?
Yes, through the chair, I just have a comment. One of the things that I was impressed about is part of the nutrition education program works with some vendors, including TOPS, so that when participants go through the program, they get vouchers or coupons that they can then take to TOPS and convert into fruits and vegetables and things for their families. So it not only teaches them about nutrition, but it also gives them an opportunity to get products to support their families. So which is one of the reasons that I supported this.
Thank you. Any other discussion? All those in favor, please signify by saying aye.
Aye.
Is there any opposed? Motion carries. Next item?
Referral 21-0348, acceptance of a grant from the New York State Department of Health and amend Resolution 14 of 2021 to increase the contract with Affinity Rehabilitation LLP for an early intervention program.
Okay. Yeah.
Moved by legislator Dvorak, second by legislator Colby. Is there any discussion? Legislator Lee?
Yes. To you, Madam Chair, to the administration, why is this year's funding so much higher than last year?
Through the chair, last year there was a change to regulation that increased the number of referrals coming from children who are affected by lead levels. And so New York State has increased the grant funding to help us adjust for the increase in referrals.
Okay, thank you.
Legislator Heber?
Thank you, Madam Chair. Through you to the administration, could you describe what the registered nurse's role is in this program?
Through the chair, the registered nurse in this program has two roles. One is to manage our developmental monitoring program. So these are children who are not quite eligible for the early intervention program, but perhaps their family is still concerned about their development. And this allows them to still be followed and get some activities to support their development. And then the nurse is also responsible for providing education and awareness about our early intervention program and referral process to our community providers.
Thank you. And through you, Madam Chair, not quite sure how to word this question, but should this be viewed as an increase in state support for the early intervention program? Or where is this money coming from?
Through the chair, I suppose it is an increase from New York State Early Intervention Program. Yes, that's correct.
Thank you, Madam Chair.
Any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next.
Referral 21-0349, authorize contract with Health System Services Limited to provide Medicare B products and supplies for residents of Monroe Community Hospital.
Moved by
Madam Chair. Second.
Moved by legislator Colby, seconded by legislator Marionetti. Is there any discussion? Legislator DeLorean?
Yes, through the chair to the administration, why is it necessary to contract with an outside vendor for these expenses?
Through the chair, resident supplies are covered under Part B. We do not carry those supplies, so for certain wound products, ostomy products, and respiratory products, a contractor will provide those and bill the Part B insurance for them.
So, as a follow-up question, if you did not have this contract and I was a resident of MCH, I would have to purchase those on my own, billing, essentially.
Either that, or you could pay privately, and then we would order them for you.
Gotcha, thank you.
Any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next.
Referral 21-0350, authorize contract with Jensen Hughes Incorporated to provide an emergency preparedness program for Monroe Community Hospital.
Move, Madam Chair. Second.
Moved by legislator Marionetti, seconded by legislator Hebert. Is there any discussion? Legislator Hebert?
Thank you, Madam Chair. Through you to the administration, has this service been provided before, and if so, who by whom?
I apologize, can you repeat the question?
Certainly, Madam Chair, through you to the administration, has this service been provided before to the county? And if so, who's provided that service?
And we are discussing the HSS, or have we moved on to the emergency preparedness plan? Thank you. Through the chair, we do have an emergency preparedness plan that was completed through Monroe County at the hospital in response to a CMS final rule from 2016. I do not know who completed that plan. We do have a contract with Jensen Hughes to provide other trainings related to emergencies, but not related to the plan specifically. I apologize.
So that's, thank you. Thank you, Madam Chair.
Legislator Reed?
Yes. Madam Chair to the administration, were any other contractors considered?
I apologize, I'm losing my head today. Can you repeat the question?
Okay. Were any other contractors considered?
Through the chair, we did receive 9 proposals. However, there were a few that were cost prohibitive that had not worked with skilled nursing facilities before. So we did review 4 different proposals that were all relatively similar. But Jensen Hughes did, they have had experience with Monroe Community Hospital before in similar projects.
Thank you. And another question for you, Madam Chair. This contract expected to be continued in 50 years?
This is a one-time contract to review and get our plan up to where we feel it needs to be. At that point in time, we hope that we can maintain the plan internally. One of the reasons why we do want to bring a contractor in to develop the plan is that there have been multiple new regulations put on nursing homes related to pandemic emergency plans, respiratory plans. So this is really our effort to get our plan to where we want it to be.
Thank you. And one more question, what vendors were used to comply with the Center for Medicare and Medicaid services required in the previous years, and what changed?
Through the chair, I don't know who created our initial emergency preparedness plan. It was before my time as executive health director. We have reviewed it, and we did have a gap analysis completed to see where our opportunities were for the plan. And that's why we ultimately decided to pursue this contract.
Thank you.
Is there any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next,
Referral 21-0355, authorize intermunicipal agreements with municipalities for Rochester Monroe County Youth Bureau programs in 2021.
Move it, Madam Chair.
Second.
moved by legislator Hubert, seconded by legislator DeFlorio. Is there any discussion? Yes, legislator Hubert.
Thank you, Madam Chair. Just through you to the administration, just to check that, my understanding is what is correct, that this money is all provided by the Office of Children and Family Services, basically pass-through money.
Through the chair, yes, that is correct.
Thank you very much, and I'll just note from my days as a youth bureau director, this is about 20% of what the state used to provide, so it's kind of sad to see. Thank you.
Anyone else? All those in favor, please signify by saying aye.
Aye.
Is there any opposed? Being none, item carries. Next item.
Referral 21-0356, authorized contract with non-for-profit agencies for Rochester Monroe County Youth Bureau programs in 2021.
Move it.
Second.
Moved by legislator DeFlorio, seconded by legislator Tardy. Is there any discussion? Yes, legislator Lee.
Thank you. Please, Madam Chair, to the administration, why is this year funding so much less than last year?
Through the chair, this is funding that comes from the New York State Office of Children and Family Services, and we're just a pass-through. This is what was allocated to us for this year.
Thank you.
Anyone else? Okay. All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0363, authorization for intermunicipal agreements and contracts with schools in Monroe County for COVID-19 testing.
Move it, Madam Chair. Second.
Moved by legislator Colby, seconded by legislator Marianetti. Is there any discussion? Or legislator Hebert?
Thank you, Madam Chair. I have a number of questions through you to the administration. Pardon my ignorance, but what is ELC grant funding? This is a matter of importance we discussed yesterday, and there's another chance to look.
Through the chair, ELC is an acronym for Epidemiology and Laboratory Capacity. It's just the acronym for the grant that this honorable body just accepted at the meeting 2 weeks ago, specifically for this purpose for COVID testing in schools.
Thank you. Through you, Madam Chair, to the administration, how much money did each school district receive from the CARES 3.0 Act, the ARPA Act, which included the HERF funds, and other similar COVID-related federal and state acts? And of that money, how much was allocated for testing?
Madam Chair, while I don't have the exact figures tonight with me, I am aware that our school districts, both the city school district and our suburban districts, were awarded approximately in the range of $370 to $400 million out of CARES Act related funding and the American Rescue Plan. Schools were required to submit their plans to state ed. I do not have access to those plans, so I can't tell this body what portion is allocated for testing.
Thank you. My calculations today, roughly, I'm guessing they got over $500 million in Buffalo City and all the different districts, but I'm not sure which one of those is right. It was a lot. And I know that they were supposed to allocate some for testing. So my next question through you, Madam Chair, is whose idea was this referral? Did our Department of Health bring it forward? Did the administration bring it forward? Did the schools come and ask us?
Madam Chair, as mentioned previously, this body accepted within the last cycle, I believe, a grant award from New York State Department of Health to Monroe County's Department of Health for the purpose of assisting schools in their reopening plans. This particular referral is consistent with those grant expectations.
Thank you for clarification through you, Madam Chair. So I honestly don't remember how much we accepted 2 weeks ago. I know it was a big number. It was approximately $16 million.
Yes, Madam Chair, it's just shy of 16 million, but it's close.
Okay, thank you. And because it lists CARES Act funding, how much funds remained in the CARES 3.0 funding the county received that remains unencumbered at this point in time?
Madam Chair, yeah, Madam Chair, a ballpark is about $3.5 million, $3.8 million. The reason, I will say, Madam Chair, the reason we reference CARES Act and the ELC grant is to provide us a little flexibility. I know it has been discussed last year at legislative meetings, plans for the CARES Act, and I think everyone is in agreement that we don't want to leave any money on the table. Being able to reference both the ELC grant and CARES Act funding gives us that claiming flexibility to ensure that we have adequate time to fully expend both of these grants.
Thank you. And through you, Madam Chair, my next question is right in line with your last comments. As I recall, the CARES Act funding has to be used up by 12/31 of this year. Is that correct? I know it has to be allocated. I thought it had to be used as well.
Madam Chair, the expectation is that all contracts have been encumbered, purchase orders executed, and the services or goods have been received by the end of the year. Payment for those goods or services can occur in January or February. What's important to the Treasury is that the goods and services were received.
That's consistent with my recollection as well. So, through you, Madam Chair, the CARES Act funding would only be used for activities up till the end of this year, correct?
Yes, Madam Chair.
Through you, Madam Chair, to the administration, how would the $16 million be distributed to districts based on size, based on some demographic? Do we have an idea yet on how that will be actually allocated?
Madam Chair, it's not a hard dollar allocation, but our Department of Health has been using the demographic information of student enrollment in each of the districts, including charter and parochial schools, in trying to best allocate this funding.
Through Madam Chair, I would request that when you have more details, you provide them to us proactively shortly after they're available to the administration.
Yes, Madam Chair, I will stress that having spent a brief period of time in a school district, I can honestly say enrollment changes weekly.
Fully understood. Through you, Madam Chair, do public and private health insurance companies have to pay for any testing prior to us reimbursing schools, or is this just all government-funded testing?
Madam Chair, with respect to this particular grant, it is not a grant requirement that third-party health insurance be billed.
Through you, Madam Chair, while it might not be a requirement for the administration, is it our intent to try to cover some of this through insurance funding?
Madam Chair, I will have to follow up with our Department of Health and respond prior to the ledge meeting. I will say that Monroe County does bill private health insurance for our work. I just don't know if it's part of the planning process of our school districts.
One last question through Madam Chair, the administration. The period of this referral is July 1st of this year to July 31st of 22. How do you intend to allocate funding for the period July 1st to whenever the county executive signs this, assuming it passes? Which it should.
Madam Chair, as mentioned, our County Department of Public Health is doing its best to utilize school enrollment data and work with each of these schools to set up their testing protocols and procedures. And we'll likely allocate those dollars based on those demographics regardless of July 1st start date for the grant.
Thank you. One last question, Madam Chair, based on the language you just used. You said that the schools would be based on enrollment, I think was your exact words. Is this enrollment or attendance? Or, I mean, my understanding is that a lot of schools are having serious attendance problems. Like the Victor School District has had to send kids home. I realize these are getting fairly detailed, but do we have any idea how we're going to manage that?
Madam Chair, I will let the Department of Public Health representative correct me by the full ledge meeting, but tonight I'm going to say that we are using enrollment is our criteria, not attendance.
Thank you, Madam Chair.
Legislator DeFleur.
Yes, through the chair to the administration, not sure if this is a question that would need to be answered by the health department directly, but does the funding from this grant specify that the funds have to go directly to the school or to support the school's reopening and stay opening plans? And that, there's a reason that I'm asking this.
Madam Chair, again, I will let the Department of Public Health correct me if I make any misstatements, but my understanding is that our county Department of Public Health can expend funds for kits, testing kits, but may also reimburse school districts for the actual testing protocols and procedures. It will be school staff administering and reporting the results of these specific tests.
So my question actually relates to the fact that I'm getting responses from many parents or information from many parents that they're having a big log jam with getting their kids back to school because the kids aren't in school to get tested because they've had to stay home because of the testing or the health attestations, and kids have sinus issues, cold issues, etc. So they're keeping their kid home. In order to get their kids back to school, they have to be tested and have to have a negative test, but can't get the test at their doctor's office. The urgent care centers are backlogged. So if the test kits are all going to end up at school and they can't be utilized because the kids aren't in school, and I'm just wondering if there's an opportunity to get these test kits into doctor's offices or other areas of the community, so that parents can utilize them to get their kids back in school. Kids are staying home sometimes up to a span of a week because parents can't get tests.
Through the chair, so working in cooperation with schools, that would be a permissible use. The process that the grant calls for is a planning process jointly between the Department of Public Health and the schools. They submit that plan, so the Department of Health is in regular contact with the schools. And yes, that would be an eligible expense to support that sort of return to school testing.
So could I offer a suggestion that be made? I don't see any representatives from the health department here. But that's a big issue in our community right now. And I would think that schools would be seeing that frustration and they may not be realizing that perhaps there's other uses that this money could go toward that would help support getting kids back into school. Thank you.
Legislator Peter.
Yeah, thank you, Madam Chair. Just one quick question, Mr. Franklin. How much of the CARES Act funding is being devoted and funded, however you want to term it, to this specific activity?
Madam Chair, I want to make sure I understood the question correctly. Is the question, how much of our CARES Act funding has been encumbered, committed, whatever, for this particular activity?
Yes.
Madam Chair, at this time, we have not committed or encumbered or otherwise utilized CARES Act funding for this specific endeavor. The goal is to, as we get closer to the end of the calendar year, make sure that if any of our encumbrances, because there is always a review process to see if our purchase orders will actually be fulfilled or if they should be reduced or canceled. The goal is to make these assessments as we get closer to the end of the calendar year so that we can make sure we are claiming in a manner that produces the best bang for our buck.
Thank you. Through you, Madam Chair, is there any idea of how you might use CARES Act funding for this project as the year draws closer to when we have to use up that money to get back to Treasury?
Madam Chair, again, just clarifying, is the question, how do we make sure?
The question is, let me try to be more specific when we can. Through Madam Chair, we can buy more test kits with CARES Act funding. You find out you still have CARES Act funding. You get to, I don't know, pick a date, December 10th, and you decide we got to spend this now or lose it.
Okay, good question, Madam Chair. The beauty of, the claiming beauty of a program like this is we'll have, assuming this referral passes and we have authorization to execute IMAs with our school districts. As this program unfolds and expenses are processed, this is a course of programming that has several appropriate claiming sources. The types of expenditures that will be incurred under the ELC grant are completely appropriate to claim against the ELC grant, but they are also of a nature that they are appropriate to claim against CARES Act funding or the American Rescue Plan award. So having multiple appropriate funding sources is what allows us the flexibility such that we can make an expenditure on December 31st with full intent of claiming to the ELC grant, and then come January 15th, realize some purchase order fell through on the CARES Act, we can shift that expense over.
Thank you. So translating what I think I've heard is you get near the December 31st date, it's conceivable that the amount of expenses that would be made available for schools for testing could exceed $16 million by whatever is left of the CARES Act money. There may be many other uses as well. That's one possibility, is that correct?
It's theoretically possible, yes, Madam Chair.
And last question, to you, Madam Chair, would you have to come back to the legislature? At what point did you have to come back to the legislature? This was 17.5 or $19 million. Would you have to come back to the legislature for additional approval?
Madam Chair, we would not be able to exceed the dollar threshold in our intermunicipal agreements with school districts. I believe this body is aware that for the past 2 years, year and a half, this county has purchased PPE and COVID testing kits and disseminated them to municipalities or school districts. So it is an expense of the county. It's not necessarily that our test kits would be purchased specifically for these intermunicipal agreements, but it's certainly allowable for the county to purchase test kits today, and then a month from now, come to the realization that we need them for a specific purpose. That purpose could be school testing.
Thank you, Madam Chair. Thank you, Mr. Franklin, for understanding this better.
Is there any other discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? That item carries. Are there any other matters to come before this committee? Being none, the September 28, 2021 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, October 26, 2021 at 5:30. Thank you. The rest of the